Hi, my name is Dr. Louisa Kimeli. I'm a psychologist and director of the Emotional Health CBT clinic in Montreal. Tonight I will be speaking about social anxiety as part of the Dr. Michael Spivak Memorial Lecture Series that was started in honor of Dr. Michael Spivak, the founder of the clinic. I will be cutting the talk into 3 parts so that it's not too long, each section. So the first part is going to be about the definition, what is social anxiety, and the causes. And then for the second part, I will focus on the changes that we can make to the thoughts. And the third part is going to be the changes that we can make to the behavior. So part 1 is really definition and cause, and part 2 and 3 are about the treatment, like how we can change it. So really, when we speak about social anxiety, we're talking about the most universal human experience. Everyone has experienced social anxiety. And if you are more of an introvert in terms of personality, like more, we're talking about a spectrum really between introversion and extroversion, like people are somewhere on the spectrum. But if you are more on the introversion side, you might be someone who really enjoys solitude. You need time just by yourself, and you find that very relaxing. And you can be like you can, go to a party or do a presentation, do something that is in the context of a group, and enjoy it. But it's just that for you, it might be more energy draining. So you might go have a lot of fun, but then need to come home and just relax by yourself in peace, versus someone who's a bit more of an extrovert, where for them, a party is like recharging their energy, and being alone for an extensive period of time is more draining. So it's really about, if you're an introvert, you crave alone time, and it's part of a preference. And that's where it's different from social anxiety, where social anxiety, you spend a lot of time alone, but the purpose of that is to reduce your anxiety. Because if you were to go out, it would be really, really anxiety provoking. So you either feel like you can't go to a party, or if you go, it's with a lot of distress. I've used this book in preparation for this talk that I discovered just recently. It was published in 2019. It's How to Be Yourself by Ellen Hendrickson. I also have a slide that presents the book at the end of the talk. But she makes a distinction where if you are an introvert, you might be at the party and think you could have been at home in your pajamas and it would have been nice too, but you're at the party and you're enjoying it, versus if you're socially anxious and you're really like at the party but wanting to hide under the table. So it's a very different experience. And another thing that I saw, or acronym that I saw in her book for the first time, but that I thought was kind of neat, is JOMO, because people talk about FOMO, like fear of missing out. And sometimes, it's a bit of a cultural thing where we think, oh, I shouldn't be at home enjoying a good book alone. I should be socializing. I should be seeing people, doing all these things that people post on Facebook, as opposed to just, being by myself, doing not much. But really, there can be a joy of missing out if you are someone who enjoys your solitude. But it's important to recognize when it's a preference, something that you really enjoy, versus when it's driven by anxiety. And so if we talk about, shyness and social anxiety, about 40% of population, and in some places they even report 60% of the population would describe themselves as shy. So if you are shy, you're not alone. And 82% of people say that they were shy at some point in time. So that's also a big number. And it also shows that it can change a little bit over time. I mean, personality characteristics like introversion, extroversion tend to be somewhat stable, but it still is not set in stone. And at different points in our lives, we can change a little bit. And 99% of people report that they have been socially anxious in some situation at some point. So universal. And like Helen Hendrickson jokes in her book, the other 1% is probably the psychopaths. So social anxiety is perfectly human. It gets to be a problem when it becomes a disorder, which is when it starts to interfere with your functioning. You know, it prevents you from doing things that you want to be able to do. And your life would be different if you weren't socially anxious. And so if we talk about social anxiety disorder, well, of course, the numbers are going to be less. So if we look at a specific point in time, like let's say this year, about 7% of Canadians are going to meet diagnostic criteria for social anxiety disorder. If we look over the lifetime, you know, what percentage of Canadians will experience a social anxiety disorder over their lifetime? Well, that's about 13% of the population. And not surprisingly at all, you know, given how much, again, of a universal experience social anxiety is, which means that, you know, you're more likely to have it become a disorder if it's not kept in check, or if, you know, given the right set of circumstances. It's the second, so social anxiety disorder is the second most common anxiety disorder after simple phobia. So you can imagine, you know, that's big numbers of people that are struggling with that. So the point, though, is that the goal of any treatment, or, you know, the goal of trying to make changes, is to remain who we are, you know, in terms of introvert or extrovert. It's not to become, you know, the social butterfly that you are not, because there's nothing wrong with who you are. It's more about having a normal level of social anxiety, which means, again, social anxiety that does not get in the way of you doing what you want to do. So if we look at the diagnostic criteria for social anxiety disorder, like the official, you know, getting the diagnosis. So it's, you know, situation that's where there's possible scrutiny that cause it, or that's when it happens. There's a fear of acting in a way that will be negatively evaluated. The situation almost always provokes the anxiety or the fear. It's avoided or endured with a lot of distress. It's out of proportion with the actual threat, which makes sense because otherwise it'd be a normal reaction. The fear, anxiety, or avoidance is persistent. So, you know, it's not just a one event kind of a thing. And most importantly, it causes distress or impairment in functioning. So that's really the difference. Like you can be socially anxious, you know, once in a while in different situations, and that's okay. But does it cause distress or impairment, or does it prevent you from doing something? And you can also have a performance specifier if the social anxiety is only in a specific context of performance. So an example of that, a good example of that might be, you know, someone who's a musician and has issues with social anxiety during performance that interferes with the performance or functioning, or that causes a lot of distress in that particular situation. And because, you know, it's important to them, it would be a social anxiety disorder. versus, you have social anxiety during interviews, it wouldn't necessarily qualify unless it really, you were in a job search mode and you were really totally incapable of doing an interview, and it was, your anxiety was out of, very much out of proportions. But otherwise, it'd probably be normal social anxiety. The first interview would be difficult, the second would be better, and so forth. Although, it's because it's such a common experience, it's a fine line between when is it social anxiety versus social anxiety disorder. So the element or the key is really by, how much distress and how much impairment it causes for you. And when we're talking about distress and impairment, we think about two major categories. So one or two major spheres, of one's life, one being occupational academic. So these are some of the manifestations of social anxiety that would, end up interfering with someone's enjoyment at work, and potentially a sense of accomplishment, belonging, and advancement. So, things like eating one's lunch alone or going out, but, because you want to hide from colleagues, it's not that you just, enjoy this and this is what you want to do, alone at the park by yourself just because you're enjoying it. But no, it's like you're hiding out in your office, avoiding collaboration, not speaking up at meetings. Like you might have, really good contributions to make, really good ideas, but you can't quite get it out, or by the time that you're ready to get it out, the topic has changed. You avoid talks, avoid travels, parties, those kinds of situations, not asking questions, avoiding, like really spending a lot of time trying to figure things out on your own, to not ask because of the social anxiety, not networking when it would be really beneficial for you because of the social anxiety. And really, in the end, it's like people at work don't really know you and you don't really know them. And that's, again, like I was mentioning before, like a lot of the effects of that. Or you might stay in a job that you don't particularly enjoy, but you fear interviews or new situations. So it's really about, being limited by your social anxiety. So you might not, there might be new tasks that you'd like to do or new learning that you'd like, and you're not asking for anything. You're not expressing yourself, expressing your ideas, and so forth. And then there's the social and personal area. So if you have social anxiety to the point where it's interfering, where it is a disorder, like you might not have as many friends as you would like, because it's difficult to make, to initiate friendships. And then you avoid the upkeep. I mean, any relationship does need sort of a two-way work, and so you're not wanting to call your friends or text or email because of the anxiety, but then over time, if people are always the ones initiating, then they might wrongly conclude that you're not interested, so it can cause harm in relationships that way. Also difficulty opening up, sharing your thoughts, sharing your feelings. And really, we all have that need to feel like we're understood and like we belong, to feel, like someone understands, really gets us, and we can talk to that person. And the same, that there's someone that we trust. And that's the only way that trust can really develop, is that you show some vulnerability, that you're able to open up. So that's, one way, one important way that social anxiety can interfere with functioning, that you end up not having these close relationships that are really important for mental health and even physical health. Or you might stay in relationships that are not fulfilling or healthy because you feel like there's nothing out there for you. And also the fact that, if you're having difficulty initiating, approaching, then you end up being a little bit at the mercy of whoever finds you. So the relationships are, people choosing you, not the reverse. And that might, luckily work out, or it may not. But it would be much better if you were able to do that as well, to be involved in starting and maintaining relationships. And they've done studies where they've looked at happiness over, people's lifespan. They followed people for decades, and one of the most important factors for happiness is the warmth of people's relationships. It's not about, having 1,000 friends on Facebook, but it's about, the few or more people that you have, that you feel really close, and there's a lot of human warmth in there. And social anxiety can get in the way of that. So that's, one more reason or why it'd be really important to deal with it if that's the case. Other examples of how social anxiety can interfere with functioning, especially if we're talking about social anxiety disorder. So there can be like trouble with daily activities, like going out to eat, taking the bus, shopping, anywhere where there's people. And the fear there is really about people, like the scrutiny, that's where it's different. Like someone might have agoraphobia, let's say, and they don't want to take the metro, but they don't want to take the metro because it's hard to leave the situation. Like they'll feel stuck and start to hyperventilate and all that. But the fear, I mean, the people are related in that they're the ones that make it hard to get out in part, like rush hour, let's say. But it's not about the people per se. Versus here, where it's really about, I'll be taking the metro, but people are going to be looking at me. What if I look at them wrong? I'll have to look at the floor. So it's, a lot about what people will be thinking, how I'll be behaving. And it can also get in the way, like social anxiety can get in the way of trying new things, avoiding new activities. So for instance, one might always have wanted to take a dance class or go to the gym, or do certain things where there are people, or even going to the movie theater, there's people. So sometimes it's not just I would say from what I've seen that most people, it is about interacting in a verbal way, but for some people it's also even the nonverbal, just being around people, even if you don't have a word to say, they'll be anxious in that situation. So the point is, social anxiety is really impairment in functioning. So it's not just, feeling uneasy in a very specific situation that, if you go to two, 3 times, you'll be fine. It's more something that causes distress. But it's difficult sometimes because avoidance can be subtle. So, you can have avoidance that is obvious. So you just will not go to the party, period. So that's clear avoidance. But you could also, go to the party, but then hang around with the family pets as opposed to the people. Stay in the kitchen, be on your phone, or if you go with someone, like not leave that person by more than an inch. So there's all these other kinds of avoidance, or even the cognitive avoidance, like in your thinking. So like either that you will say, well, I'm not going to go to this party because I wouldn't enjoy it anyway. Or you go, but you're in your head the whole time, as opposed to being, in the situation, enjoying it, taking it in. You're just like totally thinking inward. So those are all forms of avoidance. And so a key question really is, what would you do differently if you didn't have any social anxiety? Or there maybe studies that you would do, but you're not doing because there's classwork that involves participation or interaction? Would you, go to the gym? Would you go out more? Would you travel? Would you, like, what are some of the things that you would do if you didn't feel socially anxious? And the answer might be that there's not much that you would do different, and you're just maybe more of an introvert. Like, you could have two people that, where it's like their lives look the same in terms of, or similar in terms of, what they do, like what the everyday life looks like. But one person is perfectly content with it. They're choosing what they want to do just based on what they enjoy doing, and they have a very fulfilling life, and they feel connected, and all is good. But you have someone else who, again, is doing similar things, but really they're feeling really limited, because if they weren't anxious, they'd be, wanting to do all sorts of things that they're not managing to do, and they're feeling alone. And so it's important, like, if that's your situation, it's important to recognize that, so that you can make the changes that are necessary to get the life that you want, and not be limited by social anxiety. So it's really a question about, are you choosing something because you prefer it, or are you choosing something because you're avoiding the anxiety that would come with what you would prefer? In terms of the causes, like with any psychological issue, there's an interaction of factors. There's thoughts, there's behaviors. That's really the cognitive behavior therapy way of looking at things, but there's always thoughts and there's always behaviors. There's a genetic component, which is the case again with, most psychological phenomenons. So there is a predisposition, but again, it doesn't, it's not a one-on-one kind of relationship. So you could have the gene and not have the disorder. You could have the disorder and not have the gene. There's a evolution component, or that's at least another way to look at it. If you consider the fact that about 40 to 60% of adults describe themselves as shy, I don't think it's a random, fluke. If you think about evolution, like, we're social animals, and there's certainly a lot of protection that comes from that. So it's important that we have, group harmony, and it's also important for individual security. Like, if you think of a group, of humans as a group of animals, like, back in the days, like in evolution, you were a lot safer as part of the group than if you were to be all alone by yourself on the side. So there was definitely a push from an evolutionary perspective to be sociable and to care about what others think, and so forth. And that social component that then can go wrong and cause social anxiety and then interfere. But it also, if at a good degree and handled well, it can also be very helpful. And another way that I like to look at evolution, like, I always thought about it that way, I also think it's not a fluke that people, that, one of the most common fears is of speaking in front of an audience. Because again, I think that in the wild, like when we were, back in the days, if all of a sudden you've got all these pairs of eyes on you, you're in deep trouble. Like, it's, really signals danger. So I think it's normal that if you're gonna give a talk to a big audience and you're not used to doing it, because you do it every day, you do it every week, but it's more of a, once a year event or something like that, I think it's normal that the first 2 minutes when all those eyes appear on you, that you have a physiological reaction um, that then you can handle, and it doesn't have to interfere in any way. But there is sort of that evolutionary element, no doubt, when it comes to social anxiety. And there's also, the effect of development, like the events that have occurred in your life. I think both in the negative and the positive, in the sense that, if you've been bullied, or if you've had experiences where, your group of friends turned on you in high school, or, some sort of very painful experience that had a social component to it, that can definitely contribute to the development or maintenance of social anxiety disorder. And then the same, if in parallel you didn't have positive experiences, like those can also help you. So a balance of like either having had negative experiences or not enough positive experiences. So this is it for part one. So I hope that you've enjoyed learning a little bit about, what is social anxiety and just how common it is. And the next part that will be part two is going to be about the thoughts that are involved in social anxiety and how to change them. So I hope that you will be joining me.